Hi, it's Professor Robert Alexander, and today we're going to talk about Chapter 2. And this Chapter 2 is the study of human sexuality. So we're going to go ahead and launch right into it. Why the study of human sexuality is important, all the aspects of it, all the research that's been done, and some of the stereotypical views of certain culture in terms of human sexuality. So the main topics we're going to discuss today is sex advice columnists, pop psychology, thinking critically about sexuality, sex research methods, the sex researchers, contemporary research studies, emerging research perspectives, ethnicity, and sexuality. So sex information and advice transmit information about the norms rather than images about sexuality to a mass audience, a broad audience, to both inform and entertain in kind of a simplified manner. So the genre of mass media is concerned with transmitting information that is factual and accurate. And it's a main source of knowledge about sex for many of my students, including adults outside of the field of human sexuality. So when we talk about sex information, the advance, the genre, and how it transmits information and norms to mass audiences, it's important to distinguish fact from opinion. Okay? So basic to any scientific study is a fundamental commitment to what we call objectivity. Is the information that you're getting objective and not based on a falsity, right? Or based on opinion. So an observation of things as they exist in reality as opposed to our feelings or beliefs about them, right? So information and advice in terms of entertainment, is it used for financial profits? The media personalities present information as a form of entertainment. The focus on morality, traps, findings from social sciences and psychiatry, right? So the use and abuse of research finding. I'm going to show y'all how sometimes information is manipulated, all right, or even presented to reinforce their authority. The media incorporate statistics from the study's findings. Like sometimes we'll say, well, studies show that, or statistically speaking, media report the results of the study that are contradicted by subsequent research. Okay, changes in current knowledge through behavioral research. Distorted representation of sex-related research. Okay, you want to pay attention to the differences. You want to pay attention to what's being presented. And you also want to look at the trends and how information changes over time. So thinking critically about sexuality. Okay, so I mentioned earlier objectivity. These observation of things as they exist in reality as opposed to our feelings or beliefs about them. Objectivity is the study of sexuality. It is not always easy to achieve. So, sexuality can be the focal point of powerful emotions and moral ambivalence. Value judgment versus objectivity. A value judgment is an evaluation based on moral ethical standards rather than objective ones. Okay? Now we're going to talk a little bit about how to think critically about sexuality. Everybody has their own mind. Everybody has an opinion. Most people have biases. And many of us seem to think that we believe in certain stereotypes. So let's dismantle some of these. An opinion is an unsubstantiated belief or conclusion about what seems to be true according to our own thoughts. It's not based on accurate information or knowledge or concrete evidence. It's simply how we think about things that are unsubstantiated. Okay, unsubstantiated means there's no proof behind it. And a bias is a personal learning or inclination. It's when we lean in towards a certain belief. It's almost like an opinion. Okay, it leads us to select information that supports our views or beliefs while ignoring information that does not. So certain things are very factual. Now, a stereotype is a set of simplistic, rigidly held, overgeneralized beliefs about an individual, a group of people, an idea, and so forth. So stereotypical beliefs are resistance to change. Furthermore, stereotypes, especially sexual ones, they're often negative. A stereotype is a type of schema. A schema is a way in which we organize our knowledge and our thought process. It helps us to channel or filter the mass information we receive so that we can make sense of it. So these are the type of things we're going to look at in this chapter and also throughout the quarter. So I want to give an example of some common stereotypes, right? So some common stereotypes are men are always ready for sex. Okay. That might be true, actually, right? Another stereotype is nice women are not interested in sex. Another stereotype is women need a reason for sex, men need a place. Virgins are uptight and asexual. The relationships of gay men never last. That speaks to that promiscuity. Lesbian women hate men. African American men have big penises. Latino men are promiscuous. These are some common stereotypes that don't have a lot of evidence to back them up. Thinking critically about sexuality. We're going to continue on that thread. So a fallacy is an error in reasoning that affects our understanding of a subject. It distorts our thinking, leading us to false or erroneous conclusion. Okay, an error in the conclusion. The egocentric fallacy is the mistaken belief that our own personal experience and values generally are held by others. The thinking that, oh, everybody thinks this way. That's very egocentric. It is a tendency to explain the attitudes, motivations, and behaviors of others on the basis of our own beliefs in this false consensus. The ethnocentric fallacy, also known as the ethnocentrism, is the belief that our own ethnic group, nation, or culture is innately superior to others. It has been increasingly evident as a reaction to the increased awareness of ethnicity or ethnic affiliation or identity. An ethnic group is a group of people distinct from other groups because of cultural characteristics such as language, religion, and customs that are transmitted from one generation to the next, right? So this brings us to the sex research methods. Now, scientific methods. This is a method by which a hypothesis is formed from impartially gathered data and tested empirically, right? Now, we learned about hypothesis in elementary school or middle school, somewhere around that time, where we said, okay, if I give this plant soil, water, and sunlight, it will grow. I hypothesize that if this plant has these three things, this plant will grow, right? So we're talking about research concerns. When we talk about scientific research methods, there are ethical issues, ethical considerations that we have to examine, centering on the use of human beings as subjects. Informed consent, full disclosure to an individual of the purpose, the potential risk and benefits of participating in a research group. Protection from harm and confidentiality. You have to let people know, okay, if you participate in this study, the other information is going to be out there, and these are the possible risks affiliated in being a part of this study. Sampling. Okay, many of us learned about this in biology, or if we've taken any type of science course. A random sample is a sample collected in an unbiased way with the selection of each member of the sample based solely on chance. A representative sample is a small group representing a larger number in terms of age, sex, ethnicity, socioeconomic status, sexual orientation, and so on. A biased sample are samples that are not representative of the larger group. So keeping with our theme of sex research methods, clinical research is an in-depth examination of an individual or group. Number one, descriptive. Number two, individual is studied and treated for a specific problem. 3 is focuses on atypical, unhealthy behaviors, problems related to sexual and sexual functional problems. Limitation, emphasis on unhealthy or diseased behavior. Survey research, uses questionnaires or interviews to gather information. The limitation is people may be more reporters of their own sexual behavior. It's self-reported. So they might give you information that they just want you to know about, as opposed to the negative information. So observational research, unobtrusive behavior without manipulation. Participant observation, where a researcher participates in the behavior she or he is studying. So not only are you conducting your research, but you're a part of it. That would be participant observation. Experimental research is systematic manipulation of individuals or the environment to learn the effects of such manipulation on behavior. Independent variables, factors that can be manipulated or changed by the experimenter. Dependent variables, factors that are likely to be affected by changes in the independent variable. Correlational studies are measure 2 or more naturally occurring variables to determine their relationship to each other. So correlational studies measure 2 or more naturally occurring variables to determine their relationship to each other. Now we're getting real heavy into this science jargon. Okay, so stay with me. Most experimental research on sexuality depends on measuring physiological responses. So this is a hard word to pronounce, is plethysmographs. These are devices attached to the genitals to measure physiological response. Now there have been all type of plethysmographs type tests where they have attached it to the vagina. The opposite version of that, or another version of that, is the strain gouge. So they'll have certain stimulus playing at the same time. One famous strain gouge test is when they attach this rubber band. Strain gouge is a rubber band. It's also another measure of physiological response. They attach this strain gouge to male penises where the men identified that they were predominantly heterosexual. They were predominantly cisgender, and they showed them gay pornography. And they looked at who was getting aroused by the gay porn, as opposed to them saying that they were predominantly straight men. Very interesting study. If you get a chance, Google that. Look for that study. Now we're going to talk about some of our sex researchers. Now, the 3 things of studying among modernists, is they believe that sexual expression is essential to an individual's well-being. They seek to broaden the range of legitimate sexual activity, including homosexuality. They believe that female sexuality is the equal of male sexuality. Okay, and I believe all those things as well. So and this is a review of a lecture that I did a couple of weeks ago. So Richard von Krafft-Ebing, he was the man. He was a Viennese professor of psychiatry, was probably the most influential of the early researchers, because in 1886, he published this book called The Psychopathia Sexualis. And this was a collection of case histories on fetishes, sadists, masochists. He coined that term. He coined the term sadomasochism, right? And these are folks that are part of the acronym now is BDSM, bondage, discipline, sadomasochism. These are folks that get a great pleasure, great joy from humiliation. It could be something that has to do with pain, spankings, torture, bondage, chains, whips. Folks that either get great pleasure, great joy, great sexual satisfaction for either acting it out or being on the receiving end of it. So Krafft-Ebing's Psychopathia Sexualis, it brought to the public attention and discussion an immense range of sexual behaviors that have never before been documented. Now we're talking about 1886. So it was very taboo to talk about these topics in this way. So this is Richard von Kraft-Ebing, one of the forefathers of sexuality, right? Sexual research. Now, Sigmund Freud. Sigmund Freud was also a physician. And Sigmund Freud, he explored the unknown territory of the unconscious in his attempt to understand neurosis. So it started off with him looking at psychological disorders characterized by anxiety, tension, that was plaguing his patients, the folks that he was working with. So if unconscious motives were brought to the consciousness, Freud believed a person could change his or her behavior. He suggested that repression, this is to tie down or keep buried inside your mind, inside your psyche. Repression is a psychological mechanism that kept people from becoming aware of hidden memories and motives because they arouse guilt, which prevented such knowledge from entering the brain. So Freud also was a psychoanalyst. So he believed in analyzing dreams to discover the meaning was one of the various techniques that he used to, in particular, to explore the unconscious. His journeys in the mind led to the development of psychoanalysis. Okay. Now, psychoanalysis is a psychological system that ascribes behavior to the unconscious desires. Now, he had a whole list of stages that dealt with childhood all the way to adulthood. So I want to spend a little time talking about the phallic stage, because we already talked about the oral stage that happens when a baby is fixated on putting things in their mouth. Then that baby becomes fixated on things coming out of their rectum in terms of the anal stage. But the phallic stage, this has to do with both male and female develop, where the boy develops sexual desires for his mother. So we call this Oedipal complex. He simultaneously desires his mother and fears his father. He also views his father as competition. The fear leads to castration anxiety, and that's a belief that the father will cut his penis off in a rage of jealousy, right? Where a girl develops the Electra complex, desiring her father while fearing her mother. She develops what's called penis envy. Upon discovering that she does not have a penis, this makes her feel deprived. By age 6, boys and girls resolve their Oedipal and Electra complexes by relinquishing their desires for their parents of the other sex and identifying with their same-sex parent. So because of all the limitations associated with that, a lot of people didn't take Freud's work very seriously. They kind of picked bits and pieces that they did take seriously over others, but Freud's work has always been something that is historical. It's a historical interest to mainstream sex researchers. Now, German physician and psychologist Havelock Ellis, born between the years of 1859 and 1939, was the earliest important modern sexual theorist and scholar. Now, in his book, Studies in Psychology of Sex, now he had 6 volumes that were published between 1897 and 1910. They consisted of case studies, autobiographies, and personal letters that had to do with sexuality. Pointing out the relativity of sexual values was one of the most important contributions. He challenged the view that masturbation was abnormal. He was one of the first people that said, no, masturbation, that is completely okay, and all of us do it. In fact, he argued that masturbation had a positive function and released tension. Now, he asserted that a wide range of behaviors was normal, including much behavior of the Victorians, in which they considered abnormal. Many of the behaviors that Victorians considered abnormal, Havelock Ellis said, this is totally okay. This is fine. There's nothing immoral about this. There's nothing unnatural about this. In fact, it's very natural. He is also one that reevaluated homosexuality, and he insisted it was not a disease, because before Havelock, we thought that homosexuality was a disease. This is unfortunate. He said that it's not a disease or a vice, but a congenital condition. A person was born being homosexual. One did not become homosexual. This is the way in which you were born. He was revolutionary. Havelock Ellis, man, I love this dude. Now, this brings us to the famous Alfred Kinsey, right? born between 1894 and 1956, originally was a biologist that studied insects at the Indiana University and America's leading authority on gall wasps. So he didn't look at human beings. He was looking at insects at first. He destroyed forever the belief that American sexual innocence and virtue, because we thought that all these sexual desires were repressed. So he accomplished this through two books, Sexual Behavior in the Human Male, and his other book was Sexual Behavior in the Human Female, which statistically documented the actual sexual behavior of Americans. Okay? The fact that we had lust, the fact that we masturbate, the fact that we had unmet sexual desires, the fact that our sexual desires, there was a large range of these. Kinsey's largest contributions to the field were uncovering sexual diversity and variation. He also reevaluated masturbation, sexual orientation. He looked at rejecting the whole normal and abnormal dichotomy. You know, this world is bigger than black and white. Okay, it's so much more than right and wrong. So the Kinsey scale shows the spectrum of sexual orientation based on your behaviors, fantasies, and the person's sexual history. This brings us to the Kinsey scale. And I talked about it in lecture number 2. Okay, but we're going to do a quick refresher now. He says that Kinsey said that everybody falls on this continuum, what we refer to as the sexual expression continuum. Now, a 0 will be exclusively heterosexual with no homosexual underpinnings or undertones, or how you felt. If you fell in the 1 category, you're predominantly heterosexual, only incidental homosexual. Number 2 is predominantly heterosexual, but more than incidental homosexual. Number 3 is right there in the middle, equally heterosexual and homosexual, which we refer to some people as bisexual, right? Now, number 4 would be predominantly homosexual, but more than incidental heterosexual. 5 is predominantly homosexual, but incidentally heterosexual. And 6 is exclusively homosexual. So number 6 would be like Ellen DeGeneres, exclusively homosexual. She's never been with a man and never had desires to be with a man. Right? So that brings us to researchers William Masters and Virginia Johnson. They were both from St. Louis. And William Masters became interested in treating sexual difficulties, such problems as early ejaculation, erectile dysfunction in men, and the lack of orgasms in women. He was joined several years later by Virginia Johnson, who subsequently was his secretary. Okay, he trained her into becoming a researcher, and shortly thereafter, they started dating and got married. So his famous book was A Human Sexual Response, and it was an immediate success among both researchers and the public. They legitimized the fact that female masturbation by destroying the myth of the vaginal orgasm, right? They differentiated between the clitoral orgasm and the vaginal orgasm. Okay, in 1970, they published Human Sexual Inadequacy, which revolutionized sex therapy by treating sexual problems simply as difficulties that could be treated using behavioral therapy. Now, we are going to look at some contemporary research studies. The National Health of Social Life Survey says Americans are largely exclusive. Now, this test was done out of many people. It was a large sample size, and it was a random sample size. So on the average, Americans have sex about once a week. Extramarital sex is the exception, not the rule. So that is having sex outside of your relationship or outside of your marriage. Most Americans have fairly traditional sexual behaviors. Homosexuality is not as prevalent as originally believed. Orgasms appear to be the rule for men and the exception for women. So orgasms happen regularly for men, and oftentimes they are rare for women. Forced sex and the misperception of it remain critical. 3% of adult Americans claim never to have had sex. Okay, this comes from the Contemporary Research Studies, the National Health and Social Life Survey. Okay, so now we take a deeper dive into the National Survey of Family Growth, the Youth Risk Behavior, also known as YRBS, and the National College Health Assessment. Now, many of these surveys were conducted with over 13,000 students. Some of them from the grades of 9 through 12, 148 different public and private schools in 42 states, 21 local surveys revealing the following. 47% of students, 46% of females, and 48% of males reported ever having had sexual intercourse, right? This is between the age of 9 and 12. Between the grades of 9 and 12. So 15% of students, 13% of females, and 17% of males reported having had sexual intercourse with 4 or more partners during their life. 6% of students reported having had sexual intercourse for the first time before 13. 34% reported having had sexual intercourse with at least one person during the 3-month survey. 60% who have supported being currently sexually active also reported using a condom during their most sexual intercourse. Okay, at 60%, we want to raise those numbers, right? So 19% of students who reported being currently sexually active also reported that either they or their partner have used birth control before their most recent sexual intercourse. 14% of students did not use any method of contraception to prevent pregnancy during their last intercourse. 14% is a very low number. Now, 22% who reported being currently sexually active also reported using alcohol or drugs prior to their most recent sexual intercourse. 7% of students reported ever being forced to have sexual intercourse. And among 74% of students who dated or went out with someone during the 12-month prior to the survey, 10% of the students have been kissed, touched, or physically forced to have sexual intercourse when they did not want to have someone they were dating or going out with one or more times during that 12-month survey. We're going to talk more about coercion, date rape, okay? 13% of students reported having been tested for HIV, okay? So these are just some statistics that pretty much came from the Youth Risk Behavior Survey. Now, at any time throughout this quarter, you can Google some of these. You can Google the National Survey of Family Growth, the Youth Risk Behavior Survey, and the National College Health Assessment. And this was a combination of the YRBS and the National College Health Assessment. Just to give you all some facts. Okay, now, this is a quick breakdown. You can pause the video and read the percentage of undergraduate college students who reported having oral sex, vaginal sex, and anal intercourse in the past 30 days, and the percentage reported using a condom or other protective barrier. These are some interesting statistics, right? So pause the video and go ahead and read about oral sex in the past 30 days, vaginal sex in the past 30 days, and anal intercourse. The breakdown of male and female. Okay. Contemporary research studies, the National Survey of Sexual Health and Behavior is the most expansive. It also provides a needed and valuable updated overview of American sexual behavior. It reveals an increase in sexual diversity since the National Health Survey. Emerging perspectives. So a real quick definition of feminism is the movement that involves women and men working together simultaneously for equality. We work together and centers on understanding the female experience in cultural and historical context. And what that means is the social construction of gender asymmetry. So That's fancy jargon for men and women working together for the common cause, is to uplift women's experiences. Women have been marginalized throughout time, and we need each other to do the work. You know, feminism doesn't work if just women are taking on the responsibility of uplifting this marginalized population, that being women. Pay discrepancies, women being treated differently in the work setting and all throughout society. Why did it take women so long to get the right to vote? Okay, so when we talk about this idea of social construction or a social norm, things that we create socially, this is the development of social categories such as masculinity, femininity, heterosexuality, homosexuality by society. It's a social construct. And feminists believe in these basic principles that gender is significant in all aspects of social life. They believe that the female experience of sex has been devalued. Power is a critical element in the male and female relationship, and we have to take power out of it. No person should have power over the other, and ethnic diversity must be addressed. So, I consider myself a feminist for sure because I believe in equal rights for women. I think it's kind of self-congratulatory to say that, but I definitely consider myself a feminist, and I want equal rights in all categories, not just the male and female dynamic, but racially, politically, historically. I'm a big fan of diversity and equal rights, and you'll kind of hear my theme emerging throughout the quarter. Now, when we look at some of our early researchers in terms of the emerging research perspectives, gay, lesbian, bisexual, and transgender research, there are some heavy hitters. There are some proponents of gay, lesbian, and bisexual and transgender rights. So one of them being Karl Heinrich Ulrich. He was German, a German poet and a political activist who in the 1860s developed the first scientific theory about homosexuality. Carl Maria Kurtbeny was a Hungarian physician, created the terms heterosexuality and homosexuality in his attempt to understand same-sex relationships, right? So Carl coined heterosexuality and homosexuality. Magnus Hirschfeld was a leading crusader in Germany. Okay, many of them were German, especially for homosexual rights, who was a homosexual and possibly a transvestite. Now, transvestite is a person who wears clothing of the opposite sex. And in defense of homosexual rights, he argued that homosexuality was not a perversion, but rather the results of hormonal development of inborn traits. We are born being homosexual. We are born being heterosexual, which led to the popularization of the word homosexual. Homo is that root word meaning same, right? So Evelyn Hooker was born between 1907 and passed on in 1996, demonstrated that homosexuality in itself was not a psychological disorder, and also found that there was no significant difference between typical gay men and typical heterosexual men in personality characteristics. Okay, so don't be fooled by what the media, what the internet, what movies say. We have very similar personality characteristics. So her work still resonates to this day. Okay. Other emerging research perspectives. Historically, sex research has focused on primitive health, right? Which prioritized sexuality as a social problem and a behavioral risk, which fails to examine the full spectrum of individuals. Behaviors or the social and cultural factors that drive those behaviors. Now, sex research globally faces several challenges. There is no international depository for sex data. There have been few standardized terms that exist in sex research, and quantitative data, that means data that's number driven, are especially to obtain the quality, and especially the qualitative data, which is words and more descriptive research and data, are less suitable for international comparisons, right? Because what happens in the United States is going to vary from what happens in South America, what happens in Africa, what happens in Europe, Asia, right? All of these different places. So sexuality and the significance in terms of ethnicity. Now, this is very important to discover because one of the most common stereotypes strongly rooted in American history, culture, and religion is the image of Blacks as hypersexual, right? So African Americans are not hypersexual, but this dates back to slavery, right? When there was an image that the masses wanted people to feel about African Americans. And this still holds a considerable amount of damage. So Evelyn Higginbotham, she was a leading authority on African American experience, and she discussed the racialized constructions of African American women's sexuality as primitive, animal-like, and promiscuous and non-virtuous. Now, this holds no weight, right? Because there wasn't research behind it. So during the days of slavery, the representation of Blacks being sexual exploitation of Black women by their white masters. And what that means in layman terms is white men were raping Black women slaves, right? This is historical. This has been documented. And instead of them owning up to the fact that this was happening, what they did was trying to paint this image that Black women were promiscuous. Black women were hypersexual. Okay, so in efforts to adhere to the Victorian ideology and represent pure morality were deemed by Black women to be necessary for protection and upward mobility to attain respect and justice. They did this as an attempt to kind of reassure themselves that they were the dominant, more pure race. So for the younger, new African American women, however, the opposite is happening. What's becoming more visible and less reserved about their sexuality. These younger women feel more empowered, more self-assured about themselves and their sexuality. So when we look at social economic status, which this means it's a person's ranking in society based on a combination of occupational, educational, and income levels. It's an important element for the African American sexual values and behaviors. It's important for us to look at occupation, education, and the socioeconomic status, because it helps us kind of see, the community that you come out of, how you see things, your morals and values. They can be connected to it, but they also can change. Now, we use the term cultural equivalency perspective, and in this view, the attitudes, values, and behaviors of one ethnic group are similar to those of another ethnic group. Now, this is erroneous. It couldn't be further from the truth. Cultural equivalency perspective is somebody that has this feel that many of the races identify to the same things, right? Now, there may be a couple of similarities in these cultures, but the reality is many of the cultures are very different. So let's take a look at Latinos. Latinos, they happen to be the fastest growing ethnic group in the US. However, there isn't a lot of research that exists about their sexuality. So some of these things may be drawing on the little bit of data that we have collected over time. But the two common stereotypes that surround Latinos are that they are sexually permissive and Latino males are pathologically macho. Now, when we talk about macho, we use this term. When we talk about macho, we use the term machismo. Okay? And what that means is that Latino men identify with, kind of being, the breadwinner within their families. And I'm sorry, I have misplaced the slide. Okay, here we are. Gotta get you back on the right slide. Now, the stereotype for machismo, I want to pick up where we left off, is within a cultural context, machismo it seems like it's a positive concept, right? It celebrates the values of courage, strength, generosity, politeness, and respect for others. So relations between Latino men and women are significantly more skewed. Okay, they're more egalitarian than the macho stereotype. Okay, this is especially true among Latinos who are more acculturated. So, folks that you know are more acculturated or have more lived experience, and there's a lot more of a balance between Latino and male Latino males and females as the stereotype depicts. So acculturation, it's important for you to know this term. Acculturation is the process of adaptation of an ethnic group to the values, attitudes, and behaviors of the dominant culture. Okay, so another trait in the Latino community, Latino life, is familismo. And this is the commitment. I got to work on my Spanish, but familismo is a commitment to family and family members. Okay. Now, researchers that looked at familismo and their commitment, Rafael Diaz notes that familismo can be a strong factor in helping heterosexual Latinos reduce rates of unprotected sex with casual partners outside of the primary relationship. So traditional Latinos, they place a high value on the female virginity while encouraging males beginning in adolescence to be sexually active. So the three important factors must be considered when Latinos sexuality is studied. The diversity among the ethnic groups. There are many different Latinos that come from all different parts of the world, like Colombia, Puerto Rico, Ecuador, right, and Mexico. There are many others, but these are some of the different, an example of different ethnic groups within the Latino community. So the significance of socioeconomic status, and we also have to look again at acculturation, which is the process of adaptation of an ethnic group to the values, attitudes, and behaviors of the dominant culture, right? Okay, so we're going to talk a little bit about Asian American and Pacific Islanders. They are one of the fastest growing and most diverse populations in the U.S. They have significant differences in attitudes, values, and practices in the population that make it difficult to generalize about these groups without stereotyping and oversimplifying. They are less individualistic and more relationship oriented than members of other cultures. Individuals seen as products of their relationship to nature and other people. So Asian Americans are less verbal and expressive in their interactions and often rely on indirection and nonverbal communication, such as silence and avoidance of eye contact, as signs of respect. Now, these are generalizations. All of these, when I talked about Latino and African American, these are all sweeping generalizations based on a little bit of research that we have. So in Asian communities, Confucian principles, we remember studying Confucius, who was a very popular science researcher, mathematician, right? Confucian principles, which teach women to be obedient to their spouse's wishes and attentive to their needs and to be sexually loyal, play a major part in maintaining exclusivity and holding down the divorce rate among traditional Chinese families. So in contrast, men are expected to be sexually experienced, and their engagement in non-marital sex is frequently accepted. Non-marital sex is sex outside of the marriage or sex before you get married, right? So for more than a century, Japanese Americans have maintained a significant presence in the United States. Japanese Americans are continuing to emerge, continuing to grow. So Japanese cultural values of loyalty and harmony are strongly embedded in the Confucianism and feudalism concepts. That is loyalty to the ruler, okay? Loyalty to the person that's in charge. Yet Japanese lives are not strongly influenced by religion, okay? And this is interesting. Like Chinese Americans born in the United States, Japanese Americans born in the United States base partner selection more on love and individual compatibility than on family concerns. right? So it has to be based on love. It doesn't necessarily have to be based on dating and falling in love with somebody within your own ethnicity. So as with other groups, the degree of acculturation may be the most important factor affecting sexual behaviors and attitudes of Asian Americans, right? These gaps concerning the sexuality of Asian Americans and other racial and ethnic groups obviously are more empirical work needs to be done. We just need more research on all of these ethnicities. So that brings us to Middle Eastern Americans, where there is such a scarcity. There's so little data on Middle Eastern Americans, especially as it concerns women who have migrated from this religion. Other than in the context of heterosexual relationships, research is almost non-existent in the areas of sexual expression and sexual orientation among Middle Eastern Americans. So we also have wide historical context, right? Cultural and ideological in terms of gender bias, that the patriarchal system, this is a patriarchal system, means a male-dominated system in place that helps to perpetuate some of the struggles that many Middle Eastern women face when they arrive here. Okay. There's an increasing number of immigrants. The U.S. is such a melting pot. We have races and ethnicities from all over the world, and they're allowed to come to, we're allowed to come to the U.S. and express ourselves freely, oftentimes. Okay, that's debatable. But it is important that Americans be knowledgeable about the significance of culture and gender roles in the immigrant community. Okay, so we shouldn't pass judgment. We shouldn't pass judgments on beliefs, values, and things that are intrinsic and inherent and important to different cultures. It's not on us to do that. We should not be passing judgment, right? But we should be more accepting, more embracing of diversity and sexual views. Okay. Wow, we have covered a lot. You have listened to me talk for the last 30 minutes. Okay. We talked about sex advice columnists, pop psychology. We took a deep dive into thinking critically, what that means to think critically and to be objective in terms of looking at sexuality. We did a review on our sex researchers, and we looked at sex research methods, the contemporary research studies emerging, and ethnicity and sexuality. So as always, I am going to be doing a good job of that. And that's my homework assignment, is to make sure that I'm putting forth questions that are connected to the chapter, as well as questions that are connected to either tests or quizzes that we're going to have throughout the quarter. So this has been Chapter 2, Lecture 4, and I'm going to stop talking now, okay? Now feel free to go back and rewind and look at different parts of the PowerPoint if you missed something. If you have the textbook, which you should have by now, look at the textbook to kind of just further your understanding on some of these topics. Use the internet. Do what you have to do so this learning could sink in. I'm Professor Alexander, signing off for Chapter 2.